Hi, my name is Sarah Householder, and I'm going to talk to you about how to take care of someone in your life who needs a liver transplant. As patients get closer to transplant, they become more and more reliant on their support networks and support people. Yet most people step into this role from a place of love, not from experience. We created this guide as a way to help you understand how you can help take care of your loved one who needs a liver transplant. The biggest question to start with is, how does someone get a liver transplant? Whenever someone's liver is getting worse, they'll be referred to a transplant center by their GI doctor or hepatologist. After the initial evaluation, the patient and their support person will receive an education, and the patient will undergo an evaluation that'll include doctor's visits, blood tests, imaging, and a social work evaluation to make sure that they'll be successful after an intensive surgery. After the evaluation is done, they'll be reviewed by a transplant board, and if approved, listed for transplant. This process can take weeks to months, all while having a sick liver. As a result, most patients experience worse health during this period and may need to be hospitalized once or several times. They will need to take medications, and for some patients have procedures to help stabilize their liver. Most patients during this period experience sadness, stress, and anxiety. Caretakers play a large role during this process, and you are crucial to a patient's ability to be successful. We have some strategies that will help you help your loved one. First, get organized. Keep track of appointments, medications, important dates. Try and learn everything you can about the liver, the transplant process, and their specific disease. Communicate often with the transplant team and try and attend appointments as often as you can so you can hear all the information. At home, you can help the patient follow a high-protein, low-salt diet, keep up their strength for surgery, and completely avoid alcohol during the transplant evaluation process. You can also help them keep track of their medications and pay attention to any side effects. Make sure you wash all fruits and vegetables carefully and wash your hands often to avoid getting infections. And finally, try and be patient with your loved one, as during this time they may experience mood swings, frustration, and sadness. This may be related to something called hepatic encephalopathy, or HE. HE is caused by a buildup of ammonia in the blood, which is normally cleared by the liver. Common symptoms include forgetfulness, sleep changes, disorientation, and personality and behavior changes. If you notice any symptoms of HE, it's important to let your transplant center know right away. Finally, one of the most important things that you can do is remember to take care of yourself. The road to transplant can be very long, and most caregivers experience something called burnout or exhaustion from stress. The best way we have to prevent burnout is, instead of relying all on one person, try and build a network of support of people who can share responsibility. Try and take breaks for yourself, and remember to take care of your own health in the midst of all of this. Try and protect your relationship to the patient before you became a caregiver, and find moments for that. And lastly, build community. Ask your transplant center about networks that exist both locally and nationally to help caregivers find other people going through similar processes. For many, this may be one of the most difficult periods in life, yet we want you to remember that you are not alone, and that on your care team there are a lot of providers who care about their patient and want to make sure that they are successful. Thank you.